You are welcome to my channel. Today I'll continue on schistosomiasis, but it's going to be about signs and symptoms only. For you to enjoy this presentation, please go back to the life cycle of schistosomiasis. You understand better, but I will also leave the link right here. Without further ado, let's go. For you to get the exact picture of clinical signs and symptoms, particularly the pathogenesis, it is better to listen to that presentation on the life cycle of schistosomiasis. And here is the link. Let me quickly go through what the clinical signs and symptoms will be based upon. It's going to depend upon the number of eggs trapped, and of course, where those eggs have been trapped, the anatomical position, and also where the adult worms have been trapped. Also, are we dealing with an acute condition or we are dealing with chronic infection? The intensity of the infection will also determine the severity. For example, light intensity, we are talking about 100 Fs. Moderate intensity, we are talking about more than 100, close to 400, or severe when it is greater than 400 X. Just like saying the number of eggs trapped, right? Then everything we are going to see is based upon host immunity. The disease is going to manifest because the host immune system will respond to the eggs and particularly the antigens produced. So it's either we'll be dealing with the anatomical position and the antigens produced, the inflammatory process that will follow, and fibrosis or not. You will get the clearer picture when I start going through each of the organs that will be affected. Remember, we've been talking about eggs as per the clinical features. The eggs will start giving us a lot of trouble between 2 to 10 weeks. That is when the egg production will start. There will be rapid or very fast rise in antigen, and of course, the host immune system will not just be there without reacting. Then there will be reaction, there will be complex formation, inflammatory process going on, granulomatous formation, and so on. Then we will see the full blown of the signs and symptoms. The clinical features mostly will be nothing, asymptomatic. But in so many conditions, particularly amongst travelers, so you are a physician, you are not in the endemic zone for schistosomiasis, but you are picking high level of eosinophils, and you've gone through the possible differential diagnosis of eosinophilia. You can point down on anything right here. The next thing is to suspect the travel history, and if the travel history has led you to the endemic zone, then begin to suspect schistosomiasis. So the first clue in travelers now back to the non-endemic zone will likely be eosinophilia. The first sign will be itching after swimming in the contaminated water with Cercaria. And that will occur almost immediately after swimming, up to a few days post swimming. And it's likely going to involve the travelers and also people in endemic zones. This is as a result of hypersensitivity reaction. It's not, in many cases, is not the presentation with the first exposure. It is likely going to happen in repeat exposures, okay? Mostly going to occur at the feet or lower limb. Let's be precise. It's going to be at the point of entry of the larvae. Yeah, so it's found in endemic zones. And the characteristics will include that it is pruritic, papular, and with or without urticaria. So that is the first thing that one may notice, and it's due to hypersensitivity reaction. Schlemmer's age was all about local dermatitis. Now we are going into systemic effect of schistosomiasis, Katayama Syndrome. This is a systemic hypersensitivity reaction, and it's a reaction to the migrating eggs and schistosomia. Katayama is likely going to occur mostly in travelers. And why that? Because they do not have immunity against schistosomiasis. And it's likely going to occur in about 50% of the travelers that will have encounter with Cercaria that will penetrate their skin. Let me give further explanation here about Katayama syndrome because it's a separate topic on its own. Though I have not gone into the really signs and symptoms when we are dealing with Katayama syndrome, but this explanation is necessary. It may be confusing in the non-endemic zones, and why that? If the traveler has forgotten that he or she had traveled to the endemic zones, and now the person is dealing with Katayama syndrome, then it might be difficult to know. So, if no one remembers the history of traveling to endemic zone, then it is not going to be diagnosed so easily because the presentation is all over the map, which means not so precise. And apart from that, there could be temporal delay, which means it is expected to be acute infection signs and symptoms, but it may be delayed in some situations. But history of eosinophilia during investigation might be the first clue. Then history that is suggestive that the individual had visited the habitat of this parasite will also help. The first treatment is going to be corticosteroids for sure. But let me explain further that it is more with saponicum. Schistosoma japonicum and Schistosoma mansoni. Like I said, it's expected to be an acute schistosomiasis, but there may be temporal delay. And it is a hypersensitivity reaction. Common in heavily infected people after primary infection, symptoms could be self-limiting, could span over weeks, but don't let us fool ourselves. It may be fatal. So usually within 2 to 8 weeks post-infection, the antigen reaction with the immune system will lead to all this. So let's go forward. So now, the individual with Katayama will present with headache, chills. The fever may not always be there. Urticaria rashes, angioedema. There may be diarrhea. Sometimes some will present with cough that will be dry. Some with dyspnea, others with abdominal pain. Some may even have neurological symptoms. Some will already have their weight shed or lost. But the fever, when it is present, will likely be nocturnal, occurring at night. So, one, or more of these symptoms will likely occur, and that will constitute Katayama Syndrome, acute schistosomiasis. How can we make the diagnosis of Katayama Syndrome, particularly among travelers who would have visited the endemic zones and now in the Western world? Well, it is not easily diagnosed. And why that? The presentation is all over the map. There's no specific sign or symptom that is pathognomonic. So, another confusing fact here is we expect it to be acute, right? But there may be temporary delay. If that is the case, we then rest on laboratory and history that is supplied. Like eosinophilia will be pointing to that. And when the history is suggestive that these affected individuals had visited the endemic zone or zones, then we will do some few things quickly. Microscopy for the eggs of the probable schistosomiasis parasites, we'll look for it. We can have the antigen antibody or serological investigations done. We invite the lab people to help us with polymerase chain reaction, DNA, and so on. Then the appropriate treatment that could be embarked upon here is, first of all, we give corticosteroid. We give corticosteroid to reduce the inflammatory process that is ongoing. Then later on, we give praziquantel. Praziquantel will not be given immediately. And why that? I will tell you more when we're talking about treatment of schistosomiasis. But praziquantel will be delayed until about 6 to 8 weeks. But if we're dealing with temporal type of Katayama syndrome that has already been delayed, if the time of contact with the cercaria has already reached about 8 weeks, you may go ahead with praziquantel. Now, chronic infection. By way of introduction, chronic infection will have very slow or insidious onset. It depends on the type of the parasite we are dealing with. For example, Schistosoma hematobium will be giving us signs and symptoms related to genital urinary system, while the rest will likely be pointing to gastrointestinal and so on. These will be associated with ongoing infection, mostly in endemic regions of the world, but can non-frequently, occasionally occurring in travelers. It will become chronic if it is not treated or not well treated. And this can take up to many years, decades. It can last as long as 30 years. Adult worms can last up to that. I just said a while ago that it depends on the type of the parasite we are dealing with. If we are talking about Schistosoma japonicum, Mansona mekongi intercalatum, guianensis and maliensis, and some hybrid of Schistosoma hematobium, then we'll be battling with gastrointestinal problems. This is the stomach, this is the small intestine, this is the large intestine. All, including Schistosoma hematobium bovis, that is a hybrid of Schistosoma hematobium, can cause gastrointestinal tract problem. Yes, all, except Schistosoma hematobium. Even one hybrid of it can cause it. Okay? Here, the problem is that in the bowel, there will be inflammation. Granulomatous formation will occur. There will be ulceration, blood loss, and scarring. There will be stricture of the bowel, And then this can lead to intestinal obstruction and even causing appendicitis. So here, the symptoms will generally be that there will be decreased appetite, there will be diarrhea, abdominal pain that could be as a result of the entrapment of the worm or the eggs, and even abdominal bleeding, blood loss leading to anemia, particularly iron deficiency anemia. Polyps could be formed, and of course, I've alluded to the fact that there may be scarring and strictures, which will lead to intestinal obstruction and appendicitis. So, we should be careful when someone develops all these clinical signs and symptoms, not limiting it to diverticulitis, appendicitis all the time. History of travel may help us that we are dealing with a parasite. Another organ that will be affected will be the liver. And tell me which of these parasites will affect the liver. All of them. It's very possible. Now, portal hypertension. Let's go through the pattern. Eggs are trapped. And when eggs are trapped, that can set on non-fibrotic pathological process called granulomatous inflammation. That can occur along the perisinusoidal periportal spaces, which will be located inside the liver. And that will lead to a widening periportal spaces. And this phenomenon is very common in heavily infected people. But it may be as a result of collagen deposition in the periportal space as well. And that will lead to periportal fibrosis called the Seamus Papestin fibrosis. So you can see that the liver is paying a huge price. Then the portal veins are going to be blocked, occluded. Then the portal hypertension will develop. So what will the signs and symptoms be? Of course, there will be backflow, which will lead to enlarged spleen, splenomegaly, and of course the backflow into the liver itself, leading to hepatomegaly, then portocaval shunting, and then we'll be faced with gastrointestinal tract varices, including esophageal varices. Then there will be abdominal pain, bleeding along the gastrointestinal tract. When someone has esophageal varices, you can expect hematemesis. Another organ that will suffer will be the lungs. And how would that be? We're going to part two in a bit. And of course, signs and symptoms. The heart will pay a price. And why did I decide to bring the heart here? When the lungs are suffering, then the heart will pay a price under a condition known as pulmonary, meaning the heart is in trouble because the lung is in trouble. Remember, when the blood returns from the different parts of the body, they come through the right heart, and then it's pumped into the lungs. From the lungs, oxygenated blood will come down into the heart. So when there's problem in the lungs, the heart will be in trouble. So there'll be enlarged heart, called pulmonary. I will not waste your time, just to let you know how the problem in the lungs can affect the heart. Okay, I have given full explanation about how the heart pumps the blood, through that link that I've already supplied. I mean, the life cycle of schistosomiasis. If you click on that, go to this section, you find that explanation there. I will not waste your time. But just in a few seconds, the blood coming from here going to the lungs back to the heart. Now, if the lungs is in trouble, you should take a guess. The heart will be in trouble. Now, the problem with the lungs that will affect the heart, giving us called pulmonary, will be essentially that. Let's go to the part that there'll be embolization of the schistosome. I mean, the eggs will embolize in the pulmonary circulatory system from the portal systemic collateral vessels, and that will be secondary to perisinusoidal portal hypertension. The eggs will then be lodged in the arterioles of the pulmonary system. Here, granulomatous formation will occur, leading to air nitritis. Then, we'll be faced with pulmonary hypertension. When there's pulmonary hypertension, then the right heart will fail, giving us called pulmonary. The heart will become enlarged, and then the pulmonary arteries will become dilated. This is a big problem because it is killing. Why that? It is irreversible. And what are the possible signs and symptoms here? But before I move to that, the cell embolization may be precipitated when the individual is on anti-schistosoma therapy, like praziquantel. And why that? There will be development of immunological reaction or response to the exposed release antigens, from the dead ones. That could be the culprit, and it means almost anyone is prone to this. The signs and symptoms here will be essentially that there will be cough, of course, wheezing. The individual will become weak and dyspneic. Some will lose weight, and when the right heart has failed, of course, we know, in addition to all this, there will be edema, swelling, because there will be backflow. Some will come down with hemoptysis. So it's a serious, deadly, irreversible state in the signs and symptoms of schistosomiasis. Lungs schistosomiasis or pulmonary schistosomiasis with called pulmonary. You've seen this before, through the link provided on the life cycle. Here is the kidney and the adrenal glands. Okay, the ureter, draining to the bladder and urethra. Meaning, we are going now into renal system, and you should be taking your gas, schistosoma hematopia. Now, genitourinary system. Now, two systems now combined, right? Let's go through the part two very briefly. Here, the culprit will be Schistosoma hematobium, but it could also occur in its hybrids, like Schistosoma hematobium bovis and Schistosoma hematobium materi. Here, early infection will be that there will be eggs that will lead to provocation of granulomatous inflammation, and that could lead to ulceration as well as pseudopolyps formation within the vesica and urethral walls. The early infection, I've decided to put it early infection because there will be late or long-standing infection when it comes to genitourinary system. So the early infection will give us some signs and symptoms, mainly hematuria. The hematuria here will be microscopic in many, but in some will be macroscopic. Usually when we are faced with hematuria in renal system, we want to know whether it is initial, which will be through urethra, mid from renal, total from renal carcinoma, or terminal when it is about bladder carcinoma. But in schistosoma hematuria, it will be mostly terminal. And when it is severe, when it is very massive, it's going to be total. Also, in addition to that, some other signs and symptoms will include pus in urine, pyuria, hemospermia is likely in men, and then polyps will be formed. Now, genitourinary system, long-standing infection. The pathway is essentially the same, like I've said, about the early infection of genitourinary system. Now, the long-standing infection. There may be dysuria, urinary frequency, fibrosed and calcified bladder wall. Urethral stricture may be as a result of granulomatous formation leading to hydronephrosis. Then there may be bladder polyps with bladder sear and bladder neck obstruction. Hydroureter and renal failure can occur, giving us obstructive uropathy. There is likelihood of superinversion with bacteria, and that will give us pyelonephritis. When it comes to the reproductive system, it's likely going to give us problem with vagina, vulva, and cervix hypertrophy or ulceration of the same. Then presenting with vaginal bleeding. There may be nephrotic syndrome, and even with proteinuria from a complex glomerulopathy. Infertility here will involve both ways. In females, there could be blockage of the fallopian tubes, and ovaries could be involved and then damaged. In males, could block the testicles, spermatic cord, epididymis. When they are all involved, then there will be infertility. So, lastly, like I said again, the massive proteinuria here could be from a complex immune glomerulopathy. I've decided to bring out the infertility separately because many people may not think that the visitation made to the endemic zones is responsible for the infertility in these women of childbearing age today. And to those in the endemic zones, they may not think that the parasite could be responsible for the problem they are faced with. So in females, the ovaries and fallopian tubes could be involved. That could lead to infertility. In males, testicles, spermatic cord, the prostate, epididymis could all be involved and could lead to infertility. So it is wise to find out about history of travel in a young woman and young man faced with infertility before delving into deeper and deeper investigations. Okay, I'm about to get into Schistosomiasis, but I'm going to shift that to a separate presentation entirely. But just for you to have an idea that the spinal cord will be housed here, and that the brain could also be affected by these parasites. And then that the spinal cord and the brain could be affected. Like I said, I'm going to shift this presentation entirely to another separate but short presentation. So be on the lookout for that. So still on Schistosomiasis, when it comes to the spinal cord and the brain, signs and symptoms will not be presented here today. I don't want this presentation to be unnecessarily long. So with that, I've come to the end of this very presentation. I'm not done with signs and symptoms. The rest will be about neuroschistosomiasis, how schistosomiasis will affect the spinal cord and the brain. And that will come immediately after this very presentation. Thanks for listening. Remember to share. Remember to subscribe. I appreciate it.